Whenever you eat eggs, have you ever wondered what nutrients they contain, how to eat them properly and safely, and what benefits or potential risks eggs may have for your health? A large study conducted by the National Cancer Institute, part of the U.S. National Institutes of Health, followed more than 521,000 Americans for approximately 16 years. The researchers found that individuals who consumed higher amounts of eggs and dietary cholesterol had higher rates of death from heart disease, cancer, and all causes combined. First, let's answer a question that has sparked debate for decades. Are eggs really good for your health, or do they raise cholesterol and increase the risk of heart disease? You have probably heard two completely opposite opinions. Some people believe that eating 1 or 2 eggs a day is highly beneficial because eggs are packed with protein and vitamins. Others recommend limiting egg consumption because the yolk contains a significant amount of cholesterol. So, what does the scientific evidence actually say? According to nutrition experts, the answer is not as simple as good or bad. The most important factors are how many eggs you eat, how they are prepared, and your overall health condition. Eggs are considered one of the most nutrient-dense foods available. A single large egg contains only about 70 to 80 calories. Yet it provides approximately 6 to 7 grams of high-quality protein. Egg protein is classified as a complete protein because it contains all 9 essential amino acids that the human body cannot produce on its own. And as a result, eggs help build and maintain muscle, support recovery after exercise, and are especially beneficial for older adults by helping reduce age-related muscle loss. In addition to protein, eggs are rich in vitamin A, vitamin D, vitamin B12, riboflavin, selenium, and especially choline. Choline is an essential nutrient for brain health. It plays a key role in producing acetylcholine, a neurotransmitter involved in memory, learning, and nervous system function. For pregnant women, choline is also critical for healthy fetal brain development. Many adults do not consume enough choline each day, and eggs are among the best dietary sources of this important nutrient. Egg yolks also contain lutein and zeaxanthin, 2 powerful antioxidants that help protect the retina, reduce the risk of age-related macular degeneration, and support long-term eye health. Another advantage of eating eggs is that they help keep you full longer. Because eggs are rich in protein, they promote satiety more effectively than many refined carbohydrate foods. Feeling full for a longer period may reduce unnecessary snacking, help control appetite, and support healthy weight management when combined with a balanced diet. But what about cholesterol? For many years, egg yolks were considered one of the main dietary sources responsible for raising blood cholesterol. However, modern research has shown that the relationship is much more complex. In 2020, researchers from the Harvard T.H. Chan School of Public Health analyzed data from more than 215,000 American men and women who had been followed for several decades. The study found that among healthy adults, eating up to 1 egg per day did not significantly increase the risk of cardiovascular disease or stroke. When the researchers combined these findings with evidence from other large international studies, they concluded that moderate egg consumption can be part of a healthy dietary pattern for most healthy individuals. The American Heart Association also recognizes that eggs can fit into a heart-healthy diet. Their emphasis is not on the egg itself, but on the overall meal and dietary pattern. A boiled egg served with vegetables, whole grains, and fruit is very different from fried eggs accompanied by bacon, sausage, and French fries. In many cases, it is the processed meats, saturated fat, excess sodium, and highly processed foods that contribute more significantly to cardiovascular risk than the egg itself. However, this does not mean that eating unlimited amounts of eggs is beneficial. A large study conducted by the National Cancer Institute, part of the U.S. National Institutes of Health, followed more than 521,000 Americans for approximately 16 years. The researchers found that individuals who consumed higher amounts of eggs and dietary cholesterol had higher rates of death from heart disease, cancer, and all causes combined. However, the investigators emphasized that this was an observational study, meaning it identified an association rather than proving that eggs directly caused these outcomes. People who consumed the most eggs were also more likely to eat larger amounts of red meat and processed meat, smoke cigarettes, exercise less, and have generally less healthy lifestyles. Another study involving nearly 30,000 American adults also reported that higher dietary cholesterol intake and consuming additional eggs were associated with an increased risk of cardiovascular disease and premature death over time. Nevertheless, the authors stressed that these findings should be interpreted within the broader context of an individual's entire diet and lifestyle, rather than focusing solely on egg consumption. When we examine the totality of scientific evidence, it becomes clear that the issue is not whether eggs are simply good or bad. Instead, the key factors are how much you eat and how eggs fit into your overall eating pattern. For most healthy adults, eating about 1 egg per day is considered safe and provides valuable nutrients. Some individuals may even consume 2 eggs per day as part of a balanced diet, if recommended by their healthcare provider or registered dietitian. On the other hand, people with existing cardiovascular disease, familial hypercholesterolemia, or diabetes should consult their physician or dietitian to determine the amount of egg consumption that best fits their individual health needs. Preparation also plays an important role. Boiled, poached, or steamed eggs are generally healthier choices than deep-fried eggs cooked in large amounts of oil or butter. Here is the English translation, written naturally for YouTube narration. Many people believe that fried eggs are unhealthy, but in reality, the egg itself is usually not the main concern. What matters more is how the egg is cooked and what foods are eaten alongside it. When eggs are fried in large amounts of oil or butter, the calorie content of the meal increases significantly. If the cooking oil has been reused multiple times, it can begin to break down and produce oxidized compounds and other potentially harmful substances. Some studies suggest that regularly eating foods cooked in repeatedly heated oil may increase inflammation and oxidative stress in the body, which could contribute to a higher risk of cardiovascular disease over time. In addition, fried eggs are often served with sausages, bacon, ham, or French fries. These foods are typically high in saturated fat, sodium, and calories, and many of them are classified as processed meats. Eating these foods frequently may contribute to higher blood pressure, increased LDL, bad cholesterol in some individuals, weight gain, and a greater risk of heart disease. For example, a single boiled egg contains only about 70 to 80 calories. However, if that egg is fried in a generous amount of oil, and served with 2 slices of bacon, 2 sausages, and a side of French fries. The total meal can easily contain 600 to 800 calories or more, along with substantially higher amounts of saturated fat and sodium. For this reason, nutrition experts do not recommend avoiding eggs altogether. Instead, they advise limiting deep frying, avoiding the repeated use of cooking oil, and reducing the amount of processed meats and high-fat, high-sodium side dishes. If you enjoy fried eggs, you can still prepare them using a small amount of a healthier cooking oil, such as olive oil or canola oil, and pair them with plenty of vegetables to create a more balanced and nutritious meal. Eating raw eggs is not recommended because of the potential risk of salmonella infection, and raw egg whites may also reduce the body's ability to absorb certain nutrients. Perhaps the most important conclusion shared by most nutrition scientists is this: no single food determines your health. One egg cannot make you healthy, just as one egg cannot cause heart disease on its own. Long-term health is influenced by your overall dietary pattern, physical activity, sleep quality, body weight, smoking status, and many other lifestyle factors. Therefore, if you are generally healthy, enjoy eating eggs and combine them with plenty of vegetables, fruits, whole grains, and regular physical activity. Eggs can absolutely be part of a nutritious, balanced diet. However, if you have heart disease, inherited high cholesterol, or other medical conditions affecting cholesterol metabolism, it is wise to discuss your individual dietary needs with your healthcare provider, rather than relying on general recommendations. In simple terms, modern science no longer considers eggs the enemy they were once believed to be. At the same time, it does not support eating unlimited amounts without considering the bigger picture. The most reasonable conclusion is this: eat eggs in moderation, prepare them in healthy ways, and focus on the quality of your overall diet rather than judging a single food in isolation.